Hello students, welcome to the next episode of Learning with Lafferty. In this episode we're going to talk about the heart and heart disease that can go along with it. So like always, got to introduce Manee into the video. So within this video we're going to be looking at the heart of a human. Okay, a larger animal such as Manee would have a larger heart than obviously a person such as myself. And then an infant obviously would have a smaller heart. So we're going to look within the heart of what the heart is. Okay, we're going to be talking about the thing also within this video and next week's video of circulation. Okay, so what is circulation? Okay, it is a continuous flow, one way hopefully. Okay, now we'll see into a video later on with lymphatic that definitely can only go one way. But I will mention this, that the blood can kind of pull in areas and kind of flow a little bit back and forth, and that is important to understand. So think about if blood goes backwards instead of going the one-way direction it needs to go, the problems that would come with it. So think of a car going down a one-way road and the accident that would occur because it's going to run into traffic if it's going the wrong direction, okay, with that. But for the most part, when we think about circulation, we're thinking about blood going through the blood vessels, and that blood of all the things that would have held in prior videos. Okay, so of course think about the blood cells, and then also be thinking about things such as hormones and waste and all that other good stuff that we need within our blood for a purpose. Now when you're thinking about the heart, it's important to think about the location. Okay, so you got to know where the location is. I mentioned the size of the heart. Definitely be thinking about in a human adult, it's about the size of your fist. Okay, so if you were to take your fist and place it right here, okay, we think when we put our hand over our heart when we do the Pledge of Allegiance, it's usually between the second to fifth rib. Okay, so the intercostal space is where you're going to find it. Now it is going to point more towards the left. Okay, so remember when we talked way back in the left versus the right, okay, it's easy to get confused because this is my left side and this is my right side. Okay, with that said, make sure you understand that the heart mostly points to the left. Now, I'm always going to be talking about the normals until I talk about abnormals. Could the heart part point the other direction? And some people, yes. Okay, but we're always focusing on the normals. Okay, so the normal is to the left. Now, the bottom part of your heart is called the apex, and that is definitely important. Okay, so the lower point of your heart is pointing to the left. It's called the apex. It's the bottom of the heart. Now it's opposite, so view your heart like a piece of hanging fruit off of a tree, okay, and the bottom of it's the apex. The top of your heart is going to be the base. Okay, I know when we think of the base as something, we think of the bottom, okay, but in the case of your heart, okay, so his apex is here, okay, the base would be at the top. Okay, so if you view Manee as your heart just kind of hanging there pointing to the left, actually let's use baby manatee because baby manatee and mama manatee are much smaller. Okay, so it would look like this. Okay, the base is at the top, the apex is at the bottom, and is pointing left. Okay, that's something for you to definitely understand. Now, other things about the heart that are important to know, like every chapter that we've talked about, is going to be the layers, okay, tissue layers, okay, and in this case, remember, endo, myo, and epi, and even peri have not changed, okay, so as you go through the body, I've mentioned a lot in my videos of the endo, the myo, the epi, and the peri. Okay, so we definitely think of endo, that's the intimate part, okay, meaning that is what the blood is going to touch within the heart. Okay, the chambers, and we'll get to the parts here in a minute. And then of course, you know me, I'm going to have a diagram for you to help you walk you through the parts of the heart. Okay, actually, baby manatee is going to swim through the heart. Okay, you got to know the parts, but we'll get to that in a minute. So endocardium, that's going to be the part of heart that's going to be inside. Okay, that's important to understand as far as those layers. And when you're thinking about layers, especially when you think about disease, think of the itises. So itis is the inflammations, okay, that could come from those layers. Okay, and think about, like your skin, if you were to get an inflammation and if it seeps down through the layers, but we're talking about internal going outwards. Okay, so deep going to superficial when you think about the heart. So endo is that thin, smooth layer of epithelial cells that line the interior of the heart. Okay, that's important. And again, it's very smooth for the most part. It allows easy flow for blood through the heart. Now, there are extensions that also come off of this that cover the flask, the cusp of the heart valves that we'll look at and talk about here in a few minutes. Now, myo means muscle. The myocardium, okay, and again, the end part of these words will be cardium, is the heart muscle. Okay, it's the thickest layer when you look at the heart, and this is the true pump. Okay, so this is where the nerves are going to come down and going to innervate into the myocardium, and it's going to cause contracting and relaxing. Okay, that is very, very important. Now, the cardiac's unique structure also, because of the myocardium, we're going to look at the electricity of this pump in our heart, okay, this pumping layer. Now, the last layer actually literally will become the outer layer. It's called the epicardium. Okay, so the epicardium is a serous membrane. Okay, it's also considered part of the visceral layer that covers the outside of the heart. So that is called the pericardium. Okay, the pericardium is a sac, literally, that has multiple layers in it. Part of it is the epicardium. That's going to hold, almost like putting the heart in a little hammock to hold it. Okay, so the outside is the pericardium. Right below that's the epi. Right below that's the myo. And then right below that is going to be the endocardium. So lots of layers. Okay, we definitely want to keep our heart safe. So when you're thinking about that myocardium, definitely know that this is the information when we think about the actin and myosin. Okay, so when you go back and you don't totally understand that from the skeletal muscle, when I talked about the muscular system, maybe you want to watch part of that video again to understand it has those same components. Okay, so it's got actin and myosin that are activating through the use of calcium that's going to cause contracting and relaxing, pumping blood through our body. Okay, it's going to be that opening and kind of closing that I'm doing, but that's a contracting of that myocardium and a relaxing of the myocardium, allowing those chambers, those rooms to fill up. Now, when you think of the heart, definitely be thinking about, and you're going to see this, I'm going to talk about it again in that demonstration of the left versus the right side of the heart. Now, go ahead and start associating colors associated with the heart of red and blue. Okay, of red and blue. So left is red, right is blue. Now, one way I think it kind of helps you of where the state that I live in, Kentucky, we have the city of Louisville, and Louisville is known for the Cardinals. Okay, red. Okay, so as the state as a whole, we're known because that's the national bird for us, or I should say state bird, is going to be the red cardinal. So definitely think of L for red. Okay, that's important. Sometimes if you just get one, the other would be opposite. Okay, it's like, why is that important, Miss Lafferty? It's important because you need to know a high oxygen versus a low oxygen before and after these rooms. Okay, and before and after these rooms that are lower in oxygen. So it's a dual type of pump system, even though it is truly a figure 8, because the top of the heart's going to contract and then the bottom part of the heart is going to relax. But it truly is, when it happens, blood goes this way, blood goes this way, okay, and then blood, of course, is going to be sent back eventually to those areas. And when these bottom areas contract, okay, it goes this direction, it goes this direction, and then eventually, of course, it will come back. Okay, so we always start at the top of the heart, go to the bottom. Okay, but the top contracts together and the bottom contracts together. Okay, it's not a left and a right as far as contraction, but the left and the right send blood to different places. And that's important. So there's only 2 places that the heart can send blood to and receive blood from. So just 2 areas. Okay, so the lungs, it gives and receives, the heart that is. And it also will give and receive to the whole body. So giving and receiving. And that does not happen in the same little room. Okay, it's going to happen in these different rooms called chambers. And that's important to know. So we have 4 4 and 4. Okay, you're going to see those in the demonstration. 4 chambers, 4 valves that separate those chambers, and then 4 great vessels that's going to bring blood to and from the lungs or to and from the body. That's important. Okay, you definitely need to know that. So a chamber itself is either going to top ones or going to receive. Okay, the top chambers are the receiving chambers, and you've got a 50-50 shot, but you definitely needed to get it correct. Of one side is going to receive from the body, okay, and the other side is going to receive from the lungs. Okay, and I kind of did it in this to kind of help you, and I've even got to stop and think about it. Okay, I've talked about this for 20 plus years. I still have to stop and think about it. So let's look at these chambers. Okay, so the 4 chambers we're going to have is going to be the atriums at the top, or atria, and the ventricles at the bottom. Okay, again, you're going to see this within the demonstration. I want to mention them just briefly before you watch that demonstration. So tops are going to be atriums. Okay, you have a left and a right, and remember they both receive. Okay, receive from something. You get 2 choices. Lungs, okay, on this side receiving, and then on the right side is going to receive from the body. Atriums at the top, A's at the top. Now the bottom are the ventricles, and the ventricles are going to be the ones that pump. Guess what? Either to the lungs or to the body. If the right side receives from the body, the right side and the bottom is going to give to the lungs. You notice some consistency here of body, lungs, lungs, body. Okay, that will definitely help you. Okay, I'm trying to figure out ways. I'm giving you some ways to help you remember this a little bit better. Okay, because remember, most tests you have do not have pictures. Okay, even if you have pictures, definitely in a lot of programs, especially echo, okay, you're going to be looking at pictures of the heart, and you definitely need to be able to separate what you're seeing that may be backwards, okay? But most tests are just going to be multiple choice or written type questions, and you got to fill it in. It's like, I don't know. Okay, I got to figure this out because it's just a whole bunch of words when I'm reading in the book. So definitely drawing it out. Diagrams are definitely excellent ways, as you will see, as baby manatee swims its way around the heart. Okay, and you'll see definitely the importance of it. So lungs and body, I got to get that straight. So atriums are at the top, the A's are at the top, the ventricles are in the bottom. Okay, so A and V. Okay, remember, one side is going to give and receive, body and lungs, and then the opposite on the other side, okay, itself. So atriums at the top, left and right. That's the first 2. The bottom are the ventricles, left and right. Okay, and again, know that if one gives to the body, the other one then it's got to receive from the lungs, and vice versa. And I'll talk about that here in a second, again in more detail. Now the 4 chambers are going to be the rooms. Okay, so those 4 chambers are the rooms. Now separating those rooms are going to be valves. So we've got 4 valves. We've got a tricuspid, a bicuspid / mitral, and I hear it more mitral. And then we also have a pulmatic or pulmonary and aortic or aorta. Okay, so these are the 4 we're going to talk about. Okay, now, starting on this side, tricuspid, bicuspid / mitral. Okay, I'm just going to call it mitral just to make it a little bit easier. Tricuspid is on the right side. Okay, it is the valve, like a door, that's going to separate the right side on the top from the bottom. Okay, so think about if you're trying to build up pressure within a room, you got to shut the doors. Okay, but obviously one of them has to be open at some point, so again, things can come and go. Okay, but then you'd shut the door back, pressure builds up and it pushes it forward. Okay, within our blood system. So atrium on the right side, top and bottom. Atriums at the top, ventricles at the bottom. To separate those 2 is called the AV, the atrioventricular valve. Tricuspid RT to help you, okay, on this side. Now, the other one, okay, on the other side is not separating, okay. We think about the tricuspids over here. Well, guess what? We got separating on this side, we got to have separating on this side, the left side. So that's the mitral, AV valve for short, okay, but the bicuspid / mitral is going to be separating the left side, top from bottom. So blood comes in, it's open most of the time, okay, it does close when the bottom needs to fill up, the ventricles, and then push Open the next valves. So they're in between the top and the bottom, AV valves. You've got a total of 2 of them. Okay, we've got a total of 4 we're going to look at. So 2 of them separate the top from the bottom. Now the last 2 are when things leave those ventricles, they're pumping away, okay, from the heart. We've got to put a little blocker there, a little doorway. And those are going to be what they call the SL, or the semilunar valves. Okay, so one is going to the lungs. Got the same name. These are the ones that make sense. Okay, the SL valves make sense because they're going to the areas, those arteries. And there's always an artery right behind these valves. An artery right behind these valves. So these doors. So pulmatic or pulmonary. And the next one is aortic or aorta. Okay, guess what's going to be behind those? A pulmonary artery, and then a pulmonary, the aortic, or the aortic is going to have the aorta behind it. Okay, that's very, very important. So if we did the 4 chambers, the rooms, the 4 doors, the last 4 we have are going to be great vessels. The great vessels are 2 arteries and 2 veins. Okay, so let's talk about the arteries. Aorta, pulmonary. Okay, pulmonary artery. Okay, those are the 2 main arteries, okay, that we're going to be attaching to the heart directly. On the vein side, we're going to have pulmonary vein and the vena cavas. Superior vena cava and inferior vena cava. So those are the main vein of the body. So 2 arteries, 2 veins, definitely. So that's that total of 4. So make sure you're going to see it next and within this demonstration of that flow. You got to know the flow. So think of backflow. Okay, so if my left ventricle valve is not completely closing, such in a heart murmur, okay, it's going to low backflow, and that's not a good thing. Okay, that's what, of course, a heart murmur is all about. And also be thinking about, of course, the colors, left and right are important, far as left being red because it's high in oxygen, so all those vessels. And it's like, okay, why is the right side blue? Because remember, it's got to give that blood to the lungs, and once it comes back from the lungs, it comes to the left side rich in oxygen. Okay, and then once it leaves the left and goes to the body, it's going to come back to the right side. It's used all its oxygen mostly, not all of it, okay, but majority of it. Then it needs to go back that passageway back to the lungs to get more oxygen itself. Within this demonstration, I'm going to walk you through the parts of the heart. So we're going to look at 4 different chambers, which are considered to be rooms. The first one is the right atrium, right ventricle, left atrium, and left ventricle. Now those are the 4 rooms, and you notice I've separated them by a line to kind of help you, but there also would be a septum, as it's called, and that would be the walls that separate the right from the left. Now one thing to know, that blood flows from top to bottom out. Now the other parts that you need to know besides the chambers are going to be 4 valves. Now there are valves which are going to be those passageways between the top and the bottom of our hearts. So they're called AV valves for a reason. Okay, so the AV stands for atria or atrium, and the V stands for ventricle. Okay, so you notice you have one on the right side separating the top and the bottom of your heart. And then you also have one on the left side that separates the top from the bottom. And we'll look at the little extra names here in a minute. And then the last of the valves separate blood that leaves the bottom of your heart to go out of your heart. Okay, so those are going to be your SL valves. Got one that goes to your lungs, and then one that goes to the body itself. So 4 different valves that we need to know. Now you'll notice with all of those that they have an extra name. So the name on the right side, RT, is going to be called the AV tricuspid valve. So view the valves like doors that will open and close to help prevent blood going backwards. Okay, so if this door closes, then blood should not be going backwards because blood always wants to move forward. Now the other side, on the left side, is called bicuspid or mitral. Okay, so AV mitral valve separates blood from the top and the bottom on the left side. Okay, very important. Now the SL valves are pulmonary, hence its name, and aortic or aorta. Okay, those are again the doors that will stop things, okay, from leaving or also prevent things from going backwards. So we've got 4 chambers, 4 rooms, 4 valves, and then we also have 4 of these vessels that attach to the heart. So we're going to start on the right side, and we'll look at the names. We got vena cava is a vein, bringing blood back to the heart. And then we have a pulmonary trunk that is attached to arteries, bringing blood away from the heart to the lungs. Now, those are the 2 on the right side, but you notice one's a vein and one's an artery. And I'll go ahead and tell you now, even though I won't get into it in this video, that arteries, no matter the color, and you'll notice there are 2 different colors here, no matter the color, arteries always bring blood away from the heart. Veins bring blood back to the heart. So if you go ahead and know that now, that will help you in my next video. Now, that was the right side. The left side is going to have a vein called the pulmonary vein. And then also it has the aorta. So aorta is the largest, the mama of all of your arteries. And then the vein is going to be pulmonary, coming back from the lungs to the heart. So now that we've covered the 4s, 4 chambers, 4 doors, valves, and 4 different 2 veins and 2 arteries, 1 on each side. And again, the 2 areas we can go to are the lungs and the body. So we're going to start on the right side. You'll notice that the baby manatee is going to assist us in this process because that is very important. So we're always going to start on the right atrium for a reason. And you'll see that in another demonstration that I will have in this video. That's where the beat is going to start. So always start in your right atrium. That's where he is. Then he's going to move down and go through the door. If the door opens, he can go through it, the tricuspid valve. Then he's going to go to the right ventricle. Okay, so from right atrium through the door, tricuspid, to the right ventricle. Then he needs to leave to go to the lungs to get some oxygen. So then he's going to go through the next door, and the next door is called the pulmonary valve. Now once he gets to the pulmonary valve and the door opens, then he's going to be pushed through that door to the pulmonary trunk, which is better known as your pulmonary arteries. Now once he's at the pulmonary arteries, he's going to travel to the lungs. Okay. And then once he gets to the lungs, he's going to turn around. And then he's going to come back into the heart through veins. Pulmonary. And again, I'll give you an FYI. Pulmonary means lungs. Okay, so we were coming back from the lungs. We've got lots of oxygen. We're going to come into the left side, the left atrium. Then he's got to go through another door called the mitral or bicuspid. Then he's going to come down into the left ventricle because that door opened. He's in the ventricle on the left side. Now he's going to leave and go to the ocean. Okay, the ocean being of the body. He's going to go up through that valve. Hopefully that door opens, and that door is called the aortic valve. And once it opens, he's pushed into the aorta, and then around the body he's going to go. Now once he gets to every cell in the body and is given his oxygen to the body, he's going to come back around again through this vein called the vena cava. Okay, and he comes into the vena cava. There's going to be a superior, inferior, and then back into the right atrium. And the process starts all over again. Now you'll notice the different colors. The blue relates to, and in the body it would be a very dark red, but the blue in your books relate to lower in oxygen. So the right side of our heart is low in oxygen, hence why it's taking in blood that has come from the body that's low in oxygen, and then it needs to go to the lungs. The left side is going to be red because it's going to carry high oxygen. So it'd be like a scarlet red. So it receives blood from the lungs, high in oxygen, and then carries it to the body through the aorta. Now, one thing I'll point out about the aorta, I'm not going to cover it in this video, but the aorta does have 4 sections. Okay, 4 sections that I'll get into detail in the next video, but each one of those sections will bring red blood cells to various areas of our body. So the artery is going to be the largest as the aorta, and then the largest vein is going to be the vena cava, superior and inferior. Superior carries blood back from anything above the diaphragm to the right atrium, and the inferior vena cava carries blood that's below the diaphragm back to the right atrium. So hopefully the baby manatee has helped you to see how blood flows through our body. But remember, it's always from right, top, bottom, out, back to left, top, bottom, out, and then back to right atrium. So make you a flow chart if that helps you. As you can see in the picture, I drew it out. Okay, you can use straws, or you can also use, I've seen students use Twizzlers, okay? Whatever works for you. Get outside, do some sidewalk chalk, something. But you got to do something that way you're writing it out, talking about it on a regular basis to get it within your mind. Now, I'm going to go ahead and mention it now because it is important to understand with the heart of it's an organ and it needs oxygen just like every other tissue cell within our body. So the main artery that gives blood to the heart directly is called the coronary artery. So I mentioned it in this video. I'll get in more detail with it within the next video of like that branch of the aorta that brings blood to the artery directly. Okay, I'll give you a hint. It's going to be the ascending, the beginning of your aorta. It's going to have a couple different parts. But coronary artery disease is directly related to heart disease. Okay, so the main artery that gives blood to the heart is going to be the coronary artery. That's important for you to know. Now, when you think about the heart of the parts, okay, the anatomy is, remember, the structure. Okay, which is very, very important. We definitely need to know the structure. But remember, the other side of A&P, the more difficult of the two, is going to be the physiology. Okay, so definitely spend some time. You got to get understanding about the parts of the heart. Okay, that is important, the backwards and forward. But when you think about the function, let's look at first of what the purpose of the heart is. Okay, like what do we have a top and a bottom section? Okay, remember, receiving at the top, giving at the bottom. Okay, in between, remember those areas, you're going to have some doors, some valves, and those valves are going to allow the pressure to build up within the heart, and that is, think it like a roller coaster ride. So if you like roller coaster rides and you're going up the mountain, the higher, the steeper, I guess you would say, the incline is going to have, you know, lots of energy, okay, allowing that to come back to the heart itself. Now, when you're thinking about names, it is important to understand the function of the heart is pumping, it's contracting and relaxing. Okay, that's the myocardia level. So contracting and relaxing, those have fancy names. So systole and diastole. So systole is contracting, diastole is the relaxing, the resting part. So one complete cardiac cycle, a beat, a beat. Okay, contracting, relaxing, contracting, relaxing, contracting, relaxing. It lasts not even a full second. It's 0.8 seconds. Now there's an active phase of systole and diastole. Now the difference between them is contracting and relaxing. So remember, the top contracts, relaxes. The bottom, the ventricles, contract and relax. So far as our heart has what is called a cardiac cycle. Okay, and that's one beat. Okay, and that lasts about 0.8 seconds, not even a full second for a cardiac cycle to occur. And that is contracting of the top, pushes blood down. Then, of course, as it's pushed blood down, the top's going to relax. The bottom then is going to take that blood and contract, and then push that out of the heart. Okay, and then, of course, as it's doing that, after it does that, it relaxes. Pump, pump. Okay, so that lubba-dubba. Okay, sometimes this is called a heart sound that you're hearing actually those valves, the AV valves and the SL valves actually opening and closing. Now remember, the valves kind of look like, almost like a V in some ways, okay, and they open close, open, close. Okay, and that blood then is rushing through in those contracting and the relaxing. Now that is directly controlled by the myocardium. Okay, that muscle layer of the heart, that is the conduction system. That is very important to understand. So systole and diastole. Okay, contract and relax. Okay, so if the top is contracted, the bottom needs to be relaxed. And when the bottom ventricles are contracted, the top needs to be relaxed. Now that cardiac cycle then, definitely make sure you're understanding what valves are open. Now, most of the time, the AV valves, tricuspid on the right side and mitral on the left, are going to be open because it's kind of a passive process of receiving in the atriums that blood back. And then it just flows and starts filling up the ventricles. But that door has to close when the top is relaxed, so the ventricles, when they contract, they have as much blood in there and they can pump and push out the door open the SL valves, pneumatic and aortic valves, in order to get the biggest contraction. Okay, so again, it's important to understand of which of those doors are open. For the most part, the only time that those AV valves are closed shut is when the ventricles are contract. Okay, they're in systole. And so definitely understanding some different names, because it's not called contracting, relaxing. It is going to be called the fancier names, and I need to know which of those doors needs to be shut so the pressure is built up enough to push those doors open, those valves open. Now the heart is controlled by a cardiac system of conduction. Okay, so we know the heart has to be in sync. Okay, so we don't want the top contracting faster on one side versus the bottom contracting on the other side. Okay, so it's top to bottom. Okay, now it is movement of blood, obviously, is going to lungs and to body, whereas the top and bottom go two separate areas. Okay, that's important on each side. Okay, so one side is receiving from the body and then giving to the lungs, and then the other part is receiving from the lungs and giving to the body, and vice versa. Okay, it's opposite on each side of the heart. So its own conduction system is that, again, that part of the brain is going to send signals, and those signals are going to go directly to one of the four structures that live in the atriums and the ventricle walls. So you notice we get a lot of fours in this. Okay, so 4 chambers, 4 valves, 4 great vessels, and lastly 4 structures inside the walls that tell the myocardium to contract. So the first one is on the right, and it always starts on the right side of the right atrium because that's where the beat is going to start. And the right atrium, we have the pacemaker, okay, better known as the SA. Okay, so the SA, these nodes, okay, are tissue masses, okay, inside the walls that are going to send the information. So the sinoatrial, okay, hence where it's at, is located in the upper wall of the right atrium. Okay, this node initiates, it's called the pacemaker, of how fast the heart beats. Okay, how quick that contracting and relaxing is happening. Okay, top then bottom, but it starts in the top. So from the SA node, then we're going to go to the AV node. Now it's also in the walls of the right atrium. The AV node is that second node that's going to slow down the beat just for a little bit. Okay, again, we're talking about 0.8 seconds from this whole thing happening, but it is important to understand that we needed to slow down to give the top of the heart a little bit of time to relax fully before the bottom part contraction. So atrial, when we think of the atriums, the SA node, the pacemaker sends it to the left and the right, okay, equally. That innervation, okay, that means it's making those fibers contract. The AV node is number 2, it's going to slow things down. And then number 3 is this name of the bundle. Okay, it's also called the bundle of His. Some textbooks have it just as the AV bundle, atrial ventricle bundle. It is going to be in the top sections of the ventricle. Okay, the AV bundle then is kind of like the fork in the road, allows that energy to go left and right. Okay, so number 1 is pacemaker, number 2 is AV node, number 3 is the bundle, And then number 4 are the fibers embedded called the Purkinje fibers. So that's where it's going to allow the ventricle and the walls to fully contract the whole ventricle, because the ventricle is very huge in comparison to the atriums. So SA node, pacemaker, AV node, bundle of His, and then lastly the Purkinje fibers, in that order. So as you can see in this demonstration, I've kept all the parts that I had in the previous, but in this one I have added the yellow, what is going to relate to the nervous system. Now, earlier I started you in the right side for a reason, because this is where the pacemaker is, far as electricity that comes from our heart. So the names you're going to see, and there's 4 of them, is SA node, known as the sinoatrial node, aka the pacemaker. Number 2 is the AV node. Number 3 is the bundle of His, or the AV bundle, sometimes it's called. And then lastly are the Purkinje fibers. And it's in that order that the electricity current is run through the body. Remember that the nervous system has its own conduction system that directly affects the heart and to keep it in rhythm. Now, baby manatee is going to help us again, and he goes first, coming from the brain to the SA node, the pacemaker. This little thing you see here, that's embedded in the walls of our right atrium. Now then he's going to send a current that's not only going to affect the right side, but is also going to affect the left side. Okay, that is very important to also remember. Okay, so not only do we get contracting happening on the right top of our heart, but we also have contraction of the muscle, the myocardium, on the left side. Now, we have to also remember, like I mentioned earlier, that the conduction of electricity is going to be that myocardium, a muscle layer of the heart, the myocardium, that is being conducted by the electricity. So remember, the top of the heart has to completely contract and completely relax before we want the bottom of our heart contracting and relaxing. So when the top is contracted, the bottom is relaxed. And again, opposite. If the bottom is contracted, then the top must be relaxed. So if we contracted the top, then the next energy is sent to this thing called the AV node. Now the AV node is going to slow down the pulse just a little bit, so that the way it gives time for the top of the heart to completely relax. So then the energy is going to be sent down to the fork in the road, okay, the bundle of His. So the fork in the road, the bundle of His, is going to allow that energy then inside the walls of the ventricle to continue. And then Manatee's got a choice. He can either go left, or he could have gone right, okay, to the right ventricle. But the fibers are called Purkinje fibers, and these are just little fibers embedded in the walls of the ventricle that allows that energy to contract the myocardium of our ventricles. And once that happens, and guess what? He's going to start again and go from SA node to AV node to bundle of His, all the way down through the Purkinje fibers. And remember, as far as beats, the beat should be anywhere from 60 to 100. Average is about 72 in an adult. So an EKG or ECG is going to be showing the electrical activity from those 4 areas that are located within the walls of the heart. So this is where we see that cardiac cycle. Okay, and again, less than a second, 0.8 is normal average. Okay, now we see a P wave first, then we're going to see a QRS. Okay, they're called waves or deflections, and then next we're going to see a T. Now between that, you'll notice you see flat line. Flat line shows that relaxing. Okay, remember the diastole. Okay, the relaxing of the heart. Now the systole, you're going to see again one of them. The first one is the top of my heart, so that's the P for pacemaker. Then as the bottom relaxes, then I want to see contracting of the bottom of my heart. So that's the big one. Okay, the QRS. Okay, and then you're going to see the relaxing of the heart as a whole under the T wave. Really see what electricity is happening. And what they would look for, a technician would look at, of course, the height of that is very, very important. I'm not going to get into the advanced details because I'm not teaching at that level for it as a cardiac, but definitely understanding the basics. So atrial systole contracting is the P wave, okay, then you flatline. QRS, okay, wave is going to be ventral contracting, better known as systole. And then the last, the T wave, is the relaxing of the heart, okay, within that 0.8 seconds. Okay, we definitely need to know that needs to be in rhythm. Okay, if it's not in rhythm, that is definitely a problem. Okay, because then that's going to show some issues that are happening in the body. So the conduction system that I talked about concerns two different areas, the atriums and the ventricles. Now we can measure that in an ECG or an EKG. Now what we're looking for is contracting of the atriums and then contracting of the ventricles, and then in a split moment of time we'll have both sides that are going to rest. So the P wave, so think of pacemaker. When we see the SA node, the pacemaker of the heart, cause a contraction of the atriums on both sides, we're going to see a spike that goes from flat line and it will go up. And then you see a little bit of relaxing. Now I will mention that atrial can be used with the word of depolarization, which means contracting. And atrial also does what they call repolarizing, which means relaxing. Now you cannot normally see on most EKGs the relaxing of the top of our heart between these two, but do know that it is happening, okay? But we do have one part where the heart is totally going to rest. Now, the ventricles are next, okay? So if we contracted the top of our heart, okay, the upper chambers where the heartbeat starts, which is the first wave called deflection, then the lower chambers are our QRS wave, okay? So these are the ventricles contracting. So these are the ventricles contracting, creates that next wave. It's also called the QRS complex. And then once that happens, you notice it flatlines a little bit, and then we're going to see the last, the T wave, is where your heart's at rest and recovering from the beat. Then you flatline and the process starts all over again. Now, cardiac output is another thing that is important to understand of what comes in the heart, needs to leave the heart. Okay, so cardiac output. What is cardiac output? Output is heart rate, your pulse, times your stroke volume. Okay, just like what do those two things mean? Okay, so CO, as it's called for short, is what goes in the heart needs to come out of the heart. So definitely know that philosophy of what goes in the heart needs to come out of the heart, and think about what came in the heart doesn't leave the heart, then I've got an excess. Okay, think of swelling, and what goes in the heart too much leaves the heart more than it's taking in, okay, then I have a deficiency. Okay, of course the problems that could arise from that. So cardiac output is the difference that we take between two different things. The first one is your heart rate. Now your heart rate is your pulse, okay, the number of times the heart beats per minute, okay, so when you're timesing it. So average, and we went anywhere from 72, but usually 60 to 100 is kind of the norms that you'll see. Okay, I know 60 is a little low, 100 seems a little high, but somewhere in between that. Okay, so 72 is what a lot of books will say for as average of your pulse. Now cardiac output, okay, also is determined by your stroke volume. Now the stroke volume is the amount of blood that's pushed out of each ventricles per beat. But remember, we don't just measure things in one beat, we need more time frame. Okay, so that's why cardiac output is we do it for a minute. Okay, so think about when you're testing your heart rate, you need a minute to do that. Okay, so if I need a minute in the cardiac output, then as a whole, stroke volume is just one little piece. It's showing how well the ventricles are working every time it pushes blood out. Okay, with that. But we're measuring the cardiac output over a full minute. So definitely don't get confused, cardiac output and stroke volume. They're a little similar in the wording. Think of, okay, cardiac output is a minute. Okay, stroke volume is just a little segment of it, is only a little segment of it that shows how much blood just leaves the ventricle every time it pushes, or it contracts. That is important to definitely. So you take both of those, and then again, you're gonna equal your cardiac output. Okay, and that's the extent I'm going to talk about it within this video, but definitely there's some other videos I know you'll see over to the side that if you want more information, you definitely can find. Okay, but I'm not getting into advanced cardiac training by any means. I'm a very basic when it comes to the anatomy within the textbooks that I'm using for these videos. Now, we can have some variations that can happen from our heart rate, so definitely think about bradycardia, tachycardia. Those are the ones, think of a brachy, okay, putting on the brakes, okay, so slowing down. So usually most textbooks say anything below 60, okay, is considered that. Tachycardia, you think of a tachometer in the car, revving it up, okay, going up too high. Of course, you can get some arrhythmias that could happen, that could, for our sinus problems, that would be in a variation that could be happening within the heart. You can also get chamber problems where one contracts too fast. You almost get like a double beat. That can occur in those heart rates. Okay, but again, about 72 so 60 to 100 is somewhere in the middle. Okay, is what you're looking for. Now that can be altered, obviously your lifestyles. If you're more healthy, you know, your heart is used to beating at a certain beat. And again, normals is always what we look at, and then we talk about anything off of that far as a disorder or a syndrome that can come from that. Now, what's controlling the heart directly? Back to the brain. Okay, so way back I would have talked about the medulla oblongata. It has a vascular motor center. That's going to send information, especially when we think about the vagus nerve. Okay, number 10, the cranial nerves, that has a direct connection to that pacemaker, the SA node, that can speed up. Okay, so obviously if you're speeding up the heart rate, then you're increasing your CO, your cardiac output. You're slowing it down, vice versa. And then the stroke volume, that's affected more if you have constrictions downstream. To manatee, even though manatees usually do not do this, but if you think about a beaver per se, them building an area and blocking off the water flow, then that's going to constrict and cause problems to go back to the original source, okay, with that. So definitely know what controls the heart, what controls the heart rate. We think about parasympathetic and sympathetic type of controls. Last part I want to talk about would be things to listen for that would show and point toward disorders of the heart. Think of normal and abnormal. Okay, so normal sounds is that lub-a-dub, okay, lub-a-dubba. In short is S1. You're hearing again the AV valves, opening, closing, and then the S2 would be the SL valves, opening and closing. Okay, now you could have a heart murmur, and that's any type of abnormal sound, and that would be like an S3 and an S4. Okay, and again, there's some other great little videos over here that I know you will see to the side after you watch my video or while you're watching it, that you definitely can go kind of down that line if you're more interested in what those different sounds would sound like. Now, heart murmurs, again, is something that you could hear with a stethoscope. Okay, because you're listening, and it can sound like kind of like a backflow, and that's literally what's happening, and that's why heart murmurs can be very dangerous, because the fact that we want blood going forward. Okay, and if blood is going backwards, then we can end up with problems in our body. Now, so the way stethoscope would be, of course, listening to the problems, those heart murmurs, those ECGs, EKGs is going to show the electricity imbalance, okay, when you're looking at the heart. Of course, other ways, such as programs such as sonography, that's when you're going to be, of course, seeing the echoes, okay, within those classes that you'll have in an echo and even a vascular program, you'll look more in depth of stenoses and blockages, okay, that would occur, and then, of course, the use of various tools such as catheterization, endoscopes, things like that, that would be able to determine more of, okay, is this a heart problem or is it something downstream and the heart is struggling to get the blood forward. Okay, remember, we always want things going forward when we think about heart health. Now, heart disease itself is classified under a couple of different names. The first one is inflammation. Okay, so when you think of inflammations, always think of the ITIS, okay, those different layers of the heart when they become inflamed. Now, heart rhythm, things that are abnormal, okay, that's where we think of the arrhythmias, Okay, any dysfunction of that, conduction system is just kind of the generic term they'll use as arrhythmias. Okay, of course we know if the heart is out of sync, such as cardiac arrest, we use the defibrillator to get things back into rhythm. Okay, it's kind of like turning off the computer, Alt Control Delete, waiting a few seconds, and then restarting the system. Okay, that's literally what it does. Okay, you're hoping by doing the shock that it's going to shock the heart, it's going to restart, and hopefully go back to its regular rhythm. Now, congenital heart disease, okay, that's where you can have the hole in the heart, and those are present at birth. I'm not going to get into details within this video of talking about them directly, but definitely understanding that the blood flow needs to go from right top to right bottom to left top to left bottom. But before you're born, and this will be in future videos, we're going to talk about how the heart during the embryonic fetal stage is totally different as far as the flow, because we're not using our lungs and we're not using our liver when we're inside a mom. Okay, that's important to understand. So instead of going from right top to right bottom, we're going from right top to left top. Okay, because we're bypassing going to the lungs. Okay, and that's that hole in the heart. The other ones would be another stent. Okay, that would be blockage to the liver. Because we're not doing digestion at that particular point within our heart. So some of those ductuses that you'll read about are important. I am not going to, like I said, get into it intensely within this, but definitely understanding that once you're born, those areas usually fill themselves in. But obviously if you go past a certain point, they will have to be fixed, because then you're not getting enough blood back and forth from your lungs, and then not getting blood back and forth from your liver. Okay, you definitely need blood going to those two different areas. Now, beside the chambers that could be affected, you could have valve disorders. Okay, so stenosis, okay, is where you're having, of course, a hardening, a narrowing, and of course that could affect the valves directly, where they're not completely opening and closing. You can have diseases that directly affect those coronary arteries, okay, that directly give blood to the heart, a hardening of the arteries, okay, or thickening, losing its elasticity, okay, is important. Now, remember, anytime you have a thickening of the vessels, okay, of the arteries, that can cause a condition called ischemia. Now, ischemia is a word you want to be familiar with. That is a lack of blood flow to an area. Okay, so if we don't have blood flow, we have a lack of oxygen. Okay, it could be from the blockage, or it could be from a degeneration. The vessel is falling apart. Okay, and coronary disease directly affects the heart. Okay, it's going to cause problems. If we think of plaque in the heart, it could also cause thrombosis, which would be blood clots, which could be deadly. Now, the heart has a good way of telling you when it's having problems getting oxygen, like most areas if you have ischemia, but especially the heart, of angina pectoris, okay? And that is that heart, my chest feels like somebody's laying on it. It feels like, an elephant's pressing on it. It's a very severe discomfort felt and used in the region of the heart, we think of the left arm and shoulder, and the heart is saying, there's something going on here. I'm losing oxygen, help me. Okay, so it's kind of a way of a flag that the heart is going to tell you. A true heart attack then is classified as a myocardial infarction. Okay, it's kind of a funny name, but that is going to be a heart attack. Okay, an infarction itself is where the tissue is damaged and the cell tissue is not coming back. Okay, and of course, depending upon where it happened, could be deadly. Okay, especially then you're going to have thromboses that can happen, or that could have come from a thrombosis. So it can kind of go either way when we think about blood clots. The last condition I want to talk about is heart failure. So definitely be thinking about the left side of the heart versus the right side of the heart. Okay, like which side is failing is important to understand. Now the left side, again, I'll start on the right side. Okay, make more sense because that's where you want to start. The right side is going to receive from the body, and it's going to give, okay, so in the right ventricle to the lungs. Okay, so think of backflow, okay, with that. So if my right side of my heart is failing, then I'm not able to push blood to the lungs to get its oxygen. And then if I'm going backwards with that flow, then I'm heading back to the body, and that's where you're going to see like inflamed livers. You're going to think, of course, cirrhosis could be happening with that. Then you're going to see swelling of the ankles. Okay, so we think of edema in the body, okay, itself. Now on the left side, we're receiving from the lungs at the top and then giving on the bottom, the ventricles, to the body. Okay, so we think about forward with that. If I've got, a heart that's filling on the left side, my body is not getting the oxygen that it needs. So you think about if you have a failure of the left side, it's quicker, more deadly because of the fact that that's what's sending blood to the full body. Okay, that's where you can have some organ failures that will happen. Now we go backwards from that, and then we go back to the lungs. That's where you could have pulmonary edema. Okay, because then the heart's not pumping the blood to the left ventricle and out. Unfortunately, it's keeping it and going backwards with that liquid. Okay, that is going to be water going backwards. Okay, because that most of what our heart is pumping is going to be of a water consistency, okay, because most of that plasma is going to be water. So be thinking about, okay, if I got water going back to my body, I would have edema throughout my body. Okay, if I got water going to my lungs, then I'm not able to breathe. Okay, those air sacs, those alveolus are going to be filling up. So hopefully those demonstrations have helped you in the video. Okay, didn't use Manee in the video. Okay, I used baby manatee. Okay, to help demonstrate more. But definitely make sure you understand the structure. Okay, the fours. A lot of fours in this chapter. Definitely make sure you understand, cardiac cycle versus cardiac output. Okay, again, what goes in the heart needs to come out equally. Okay, not too little or too much. Those heart studies, okay, of how you would be able to determine if the heart is having problems, and looking at the different types of diseases that could affect my heart. So stay heart healthy this week. Hopefully get outside and do some exercise. Maybe go swimming. Maybe go swimming with a manatee. Okay, that's hopefully something I'll get to do here before long. But hopefully I've helped you to understand a little bit more of how to be heart smart. I will see you within the next video where I will connect up the arteries and the veins directly to those great vessels that come off of your heart.